Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back to Policy and Rights here on Depictions Media Radio, and my name is Michael Clogs, your host. So today we're going to talk about firstly with PAHO, that there are shortages globally on oxygen supplies, healthcare workers, a lot of things that will affect those countries that have few resources to begin with. And there are people looking for aid and for help with the pandemic. And while we do live in a country that has plenty, we have the resources, we have the hospitals available to us. Even the supplies are being stretched at times in our own hospitals here in North America. In South America, in countries like Bolivia and Brazil, they're seeing emergent need for aid and for help to deal with the pandemic because of rising number of cases and stretched resources. So, as a quote from Dr. Carissa Etienne, the director of the Pan American Health Organization, or PAHO, amid the COVID-19 pandemic, the rise in hospitalizations across the region is triggering an unprecedented oxygen supply challenge. And the PAHO is helping countries scale up oxygen production by donating vital supplies, including 7,000 pulse oximeters and nearly 2,000 oxygen compressors. So, and that will help, but it's probably not nearly enough needed. So we'll be listening to Dr. Etienne and her team with the Pan American Health Organization, or PAHO, today, along with a few other cool things that have happened. That the province of British Columbia has announced a $2 million Project Hope. It aimed at helping those with ALS and research and other things that are needed to help those with ALS. While we're still in British Columbia, if you didn't pay your COVID-19 fines that you were issued, or that you were maybe stopped at a traffic checkpoint because you were leaving one health jurisdiction to go to another health jurisdiction, and you received a fine, I would advise paying it, or else unpaid fines in British Columbia are likely to lead to refusal of renewal of your driver's license. and that is also amid some other miscellaneous statutes and amendments that is on the legislative floor in British Columbia, along with some other things that we're going to get into some human rights here with family ministries wanting to get tougher on abuse issues, and so there's going to be a tougher act on domestic abuse, and in the in that Miscellaneous Statutes Act. So along moving back to Canada itself, we have federal ministers that are helping small businesses do big things, and under the branding of Team Canada, which is a great thing. Where one of the things is, imagine a recyclable N95 mask. It's reusable and can be recycled back into use after being used several times. And Joe Biden, the President of the United States, will be also addressing issues as they're moving forward with almost another 50 million vaccines administered. So the U.S. vaccination program is moving along quite quickly and well under the direction of the Biden administration. So there is also some sad news to come, where the UN has issued that an announcement about aid workers that were killed in the South Sudan. The South Sudanese people have not only been hit with famine, but they've been hit with war. They've been hit with so many difficulties to that particular region, and the aid workers are just trying to help those people live the life that they normally would live. And so they were giving these people aid, usually in the form of medications and food and things. So when you sign on to become an aid worker like that, I imagine that, of course, you know that there's some dangers involved, and that the political unrest that are in certain areas, and the fear that actually exists. So them going ahead with that work and moving forward, trying to help the people who really need it, is very commendable. And it is sad that anyone under a flag of peace and help would be killed. So let's move on with today's first press conference, and that will be with Dr. Etienne and Paho. Thank you for listening to Depictions Media Radio. Welcome back, everyone, and our next press conference is with the Pan American Health Organization, or PAHO. This is a media update for May 12th, 2021, and it is about, of course, healthcare and health in North and South America. And there's a quote here: amid the COVID COVID-19 pandemic, the rise in hospitalizations across our region is triggering an unprecedented oxygen supply challenge. And in response, PAHO is helping countries scale up oxygen production, donating vital supplies, including 7,000 pulse oximeters and nearly 2,000 oxygen compressors. That is a quote from Dr. Carissa Etienne, the PAHO director. So, in the Americas, the rise of COVID seems to be greater than any other region in comparison to Europe or Asia. There is a comparable country with India having such a huge problem with COVID, but understanding that two of the richest countries in the world are included in the Americans, with Canada and the United States, so it would seem that maybe those two countries can do more to help some of the countries that have smaller resources and the ability to produce vaccines and the ability to be able to produce oxygen compressors and the pulse oximeters needed to help monitor and supply oxygen to those patients that are in need with COVID-19. So there we have it. Let's listen to what Dr. Carissa Etienne and her team from the Pan American Health Organization actually have to say.
Hola, muy buenos días.
Good morning. Welcome to this press briefing organized by the Pan American Health Organization on the COVID-19 pandemic in the region of the Americas this Wednesday, May 12, 2021. My name is Sebastiano Leal with the Communications Department at PAHO, and this session will be about an hour long. We have already received your questions via email, and you will also be able to ask your questions live and also through the chat and the Q&A button. Please do include your name and media outlet when sending your questions. Let me remind you that we have simultaneous interpretation into English, Portuguese, French, and you will be able to choose the language of your choice by selecting interpretation. Today, Dr. Carissa Etienne will be informing on the situation of the pandemic in the region, as well as the situation with the health services and health workers. We have Dr. Jarbas Barbosa joining Dr. Etienne, Jarbas Barbosa, who is Assistant Director, Dr. Ciro Ugarte, Director of Health Emergencies, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19. Now I would like to invite Dr. Carissa Etienne to share her opening remarks. Dr. Etienne, you have the floor.
Good morning, and thank you for joining today's press briefing. In the last week, our region reported more than 1.2 million new COVID cases and nearly 34,000 COVID-related deaths. Nearly 40% of all global deaths reported last week happened right here in the Americas. This is a clear sign that transmission is far from being controlled in our region, even as countries like the United States and Brazil are reporting reductions in cases. In North America, Canada is seeing higher rates of infections than the United States, particularly across eastern Canada and the Northern Territory, home to a majority indigenous population. Cuba continues to drive most new infections in the Caribbean, although smaller countries like Trinidad and Tobago are experiencing significant jumps. In St. Vincent and the Grenadines, COVID-19 cases in evacuation shelters continues to be a challenge following the frequent volcanic eruptions. Throughout much of the Americas, we are seeing cases accelerate along national borders. In Central America, jumps in infections are being reported along the regions of Costa Rica and Honduras bordering Nicaragua, and in border regions of Guatemala and El Salvador. In South America, cases are surging in the areas of Guyana and Bolivia that border Brazil, and in Colombia, where COVID-19 cases have been steadily increasing over several weeks. We expect even steeper rises following a week of protests in Colombia. Our health systems are challenged to care for an influx in COVID patients as they scale vaccination efforts. More than 140 million people have been fully vaccinated against COVID in the Americas. The WHO's recent approval of the Sinopharm vaccine offers fresh confidence to countries in the region where the vaccine is already in use and brings hope for expanding access to vaccines in the Americas. But until we have enough vaccines to protect everyone, our health systems and the patients that rely on them remain in danger. Across our region, nearly 80% of our intensive care units are filled with COVID patients, and the numbers are even more dire in some places. In Chile and Peru, 95% of ICU beds are occupied, the majority by COVID patients. Buenos Aires, where 96% of ICU beds are in use, just tightened restrictions to avoid the collapse of hospitals. Some areas in Brazil have waiting lists for ICU beds. The rise in hospitalization has meant that our health workers are working overtime and juggling more responsibilities as they manage more patients now than at any other point in the pandemic. PAHO has helped deploy 26 emergency medical teams across 23 countries in the Americas to provide specialized care where it is most needed. Also, some 400 emergency medical teams at alternative medical care sites were set up, helping our countries expand their capacity with over 14,000 new hospital beds and 1,500 more intensive care beds. But based on how COVID is spreading, we estimate we'll need 20,000 doctors and more than 30,000 nurses to manage the ICU needs of just half of the countries in Latin America and the Caribbean. Our health workers are also facing mounting challenges as the life-saving supplies that they rely on, like oxygen, are running dangerously low. A typical COVID patient can require up to 300,000 liters of oxygen during a 20-day hospital stay. And patients in critical care often need double that. So it is no surprise that the rise in hospitalizations across our region are triggering an unprecedented oxygen supply challenge throughout the Americas. Many countries and local governments have had to quickly develop technical skills and find urgent solutions to provide oxygen for patients. PAHO has been focused on mapping the oxygen supplies across our region to identify where help is more urgently needed. And we created a technical group to provide expertise so countries can make needed investments. To fill critical gaps, PAHO donated more than 7,000 pulse oximeters and nearly 2,000 oxygen concentrators to help health workers identify when a patient needs oxygen and to ensure that they have the supplies to help them recover. We are working hand in hand with ministries of health, particularly in hard-hit places like Bolivia, Antigua and Barbuda, to help countries redesign their models of care and update their clinical guidelines to optimize resource available and ensure that more patients receive the oxygen that they need. We are also helping countries safely scale their oxygen production and to make needed investments in equipment, updates, maintenance, and human resources so oxygen is consistently available everywhere now and into the future. Throughout this pandemic, we have seen what happens when countries deprioritize health systems. Whether it was shortages of PPEs, ICU beds, oxygen, or health workers, countries are being forced to act quickly to make up for years of underinvestment. And while countries have dramatically expanded their healthcare capacity in just a few months' time, our health workers are continuing to feel the strain of this pandemic. While data is limited, we know that at least 1.8 million health workers have become infected with COVID in our region since the start of the pandemic. This is 12% of our estimated health workforce of 15 million, and over 9,000 have died from the virus, and the majority of them have been women and nurses. So as we commemorate today's International Day of the Nurse, let's honor the work, the sacrifice, and the contributions of nurses throughout the Americas who are helping provide life-saving care to COVID patients. Reports from 18 countries in Latin America and the Caribbean show that about 1.5 million health workers are now fully vaccinated against COVID with both doses. But we urge countries to make the most of limited doses by protecting health workers, including the 8.4 million nurses working in our region, and to prioritize them first. And finally, to improve our COVID response and build back better from this pandemic, let's invest in nurses and ensure that they have the tools, the training, and the resources that they need to do their jobs safely. Thanks.
Muchas gracias, doctora.
Thank you very much, Dr. Etienne. Now we will move on to answering the questions that we have received already and that we are still receiving through the Q&A. Please do remember to include your name and media outlet when sending the questions. The first question is by Chris Vilches, who is a journalist with El Comercio, Peru. She's asking, when will the COVAX facility be able to have the Sinopharm doses? In what quantities and what countries will be receiving these vaccines? Dr. Barbosa, thank you very much for the question. We have many vaccines that are being assessed by WHO so that after the assessment they can be included in the list of vaccines for emergency use. The latest one is the Sinopharm vaccine. It is an excellent piece of news, as Madam Director just underscored. the more vaccines we have authorized for emergency use, the more supply of vaccines we will have for the COVAX facility. There are other vaccines that are still being assessed, and this process oftentimes is not only related to WHO in Geneva, but this is highly dependent on the quality and the information provided by vaccine producers to be able to determine the safety, quality, and efficacy of the vaccines. This is a good piece of news, but we don't know when we will be receiving the first vaccines by Sinopharm for Latin America and the Caribbean, because we are concluding the agreements for those vaccines. At any rate, it's good news. It is another producer, but certainly we won't have those vaccines within a week or a month. So we need to continue using vaccines in a rational fashion for the most vulnerable groups. And PAHO continues to make efforts to find donations for countries that already have vaccines to cover for their own needs, so that those donations can supplement the vaccines that are offered through COVAX, and countries may have faster access to the vaccines they need. Thank you. Thank you, Doctor. The next questions are related to the variants. Chris Vilches, also with El Comercio, and Melina Ochoa with UNO-TV in Mexico, is asking the following. Chris is asking, what countries in the region have already reported the South African and the Indian variant? Is it possible for them to spread rapidly in all of the countries? And Melina Ochoa is asking whether the Mexican population should be concerned about the circulation of the Indian variant in Mexico, which has been classified as a variant of concern by WHO, and she's asking and also whether the COVID-19 vaccines are effective against the Indian variant. Thank you very much. This is Dr. Aldigueri. I'll try to combine the questions and focus my answers. Yesterday, B1617, which is predominant in India, has been confirmed in 6 countries of the region in North America, Central America, and South America, and the Caribbean. As to the variant that was initially detected in South America, that variant has been confirmed in 17 countries throughout the subregions of the Americas, and we already communicated this in earlier press briefings. As to the predominant variant in India, some observations and findings allow us to conclude that it has enhanced capacity to be transmitted, as we have seen with other variants of concerns. Also, as a cautionary principle, that variant of India has been classified as a variant of great concern. However, we should also mention that there is no evidence so far to infer that that variant or other circulating variants may be more aggressive or more lethal. Where has it been detected? It has been detected in some sporadic cases and mainly in travelers. So far, none of those events has led to an increase in the number of cases or the displacement of other variants that had already been circulating in the region. Even though it is eventually possible for some circulating variants in the region of the Americas to start to increase circulation, the control measures as implemented, such as the use of masks, face masks, and also social distancing, all in vaccination now, all of these measures have proven to be or shown to be sufficient to halt the transmission of any variant. Now, as to the specific aspects of the question by Mexico, INDRA in Mexico, as we already commented last week, is leading the National Genomic Surveillance Network that has also detected variants that are circulating in the country, and certainly other variants will be detected. I would like to underscore that Mexico is participating in notifying, reporting in real time to the genomic network, and INDRA is one of the 6 regional labs of reference for genomic surveillance in the region of the Americas. I hope I have addressed the concerns of both media outlets in Peru and Mexico. Thank you. Thank you, Doctor. The next question have to do with Venezuela, and they were sent by Nicole Yapur from Bloomberg, Venezuela, and Mariana Suquet from Efecto Cocuyo. Could PAJO confirm the reception of the second portion of the payment by Venezuela to the COVAX facility, and if received, when is it expected to send the first vaccines to the country, and who's the producer? And also Mariana is asking, how are the negotiations moving forward, as well as a vaccination schedule, and does PAJO know how many individuals have been vaccinated in Venezuela or how many doses have been administered in the country? Dr. Ugarte, thank you very much for those questions. They are very important. We have received information from Gavi, that is the financial mechanism within COVAX, indicating that Venezuela has made additional payments towards the outstanding balance. So the balance of funds continues to shrink. That balance used to be $18 million a couple of days ago, and Venezuela would be receiving the vaccines available when it is time to plan the next shipment, and that would be mid-June, late June. So Venezuela would be receiving the vaccines in about those times, and unless there are any delays that we all know could happen. As to the type of vaccine, it has not been determined, but it is likely for them to receive the Johnson & Johnson vaccine or other vaccines that may be available then. As to the negotiations, I would like to underscore the openness of the Ministry of Health, the opposition, the scientific society, the National Academy of Medicine, as well as other actors, to discuss, review the process to finalize the plan and its implementation, and also to include monitoring and also prioritization, etc. All of this is a very complex and long process, and some technical groups have also been participating with additional support. To that end, the plan needs to be discussed. Today, another meeting was held or will be held to discuss this process in greater detail, and we are optimistic as to the release of additional funds, not only for vaccines for COVID-19 for Venezuela, but also for the implementation of vaccination, including logistics, cold chain, monitoring, and review, always based on equality, transparency, solidarity, which are the basis of the discussion that we are holding within the technical table for discussing the issue of the vaccine. Thank you very much. The next questions were sent by Stephen Cillian from St. Martin and Douglas from Jamaica Information Services. Stephen is asking in English.
In exports to other countries due to a surge in the COVID-19 virus in India, how is the suspension expected to impact in the region's vaccines rollout? Y Douglas McIntosh dice si en inglés también, if we can please remind of the quantities and timelines for the delivery of Moderna vaccines in the region. Dr. Barbosa.
Thank you. Thank you for these questions. First, of course, that we are concerned about the limitations or the suspension from the government of India to allow the Serum Institute of India to export the vaccines that they are committed with COVAX facility. They have a contract signed, they received the payment, but they are not being allowed to export the vaccine. WTO, Gavi are in negotiation with the government of India, trying to reach an agreement that could allow the government of India to receive a certain amount of vaccine to their use in the national immunization program of India, because of course that this is also a very important public health emergency now in India, but also to at least partially deploy the vaccines to COVAX facility. We haven't heard so far an announcement about the finalization of this agreement, so the suspension still remains. This is concerning because we have only 3 countries in the region that are receiving vaccines from the Serum Institute of India, Bolivia, Nicaragua, and Haiti. But if this problem is not solved, the vaccines that are available will be split among all the countries. So even in the situation that now we have new sites that produce the AstraZeneca vaccine that received the EUL, the authorization for emergency use by WTO. Now we have a producer in China, we have a producer in Spain, and we are expecting another producer in Italy. But even with these new producers from AstraZeneca, for AstraZeneca vaccine starting deploying vaccine, probably we can face during this month, May and in June, serious problems to guarantee that the estimation, the vaccines that were estimated to be deployed to the countries really get to the countries. So this is a concern, and we hope that we can find a good agreement, that all the countries could find a good agreement with Indian government, that the negotiation that WTO is conducting with the government of India can have a good result, and we can count with the vaccines from Serum Institute of India. The second question about the Moderna vaccines, Moderna committed around 500 million doses to COVAX, but only around 46 million this year. So most of the vaccines will be deployed during the first quarter of 2022. Thank you.
Gracias, doctor. Siguientes preguntas son...
Thank you very much, doctor. The next questions are by Rachel Scott from The Guardian in Bahamas, Jacqueline Charles from Miami Herald, and also Jasmine Brown from Bahamas. And in English, the question is,
given the currently dire situation with COVID-19 in the Americas. What are the expert thoughts on tourism-dependent countries loosening travel restrictions for fully vaccinated tourists at this time? Do you advise against it? Jacqueline Charles del Miami Herald también preguntó, how will the resumption of cruising affect the progress that the Caribbean has made? The industry is proposing bringing cruise passengers back, and not all are mandating vaccines for crew and passengers. Dr. Aldigueri?
Thank you, Ms. Charles, Scott, and Brown, I think, for this series of questions. I will try to combine the context and my answers. FAO is aware of the strain that the pandemic is posing on the tourism industry and on national economies depending on tourism, specifically in the Caribbean. As well as we are aware of the efforts of cruise lines to establish preventive and mitigation measures on board vessels. However, considering the major COVID-19 transmission events that occurred on board cruise ships worldwide at the beginning of the pandemic, it is imperative to act with utmost caution. At present, with the evolution of the spread of the virus across the Americas and in Europe, the unknowns related to the impact of COVID-19 vaccines on the transmission of the virus, and the challenges related to accessing the vaccine and to roll out vaccination campaign in most countries of the regions, we need to act with caution. The WHO position paper published in February 2021 states that proof of vaccination against COVID-19 should neither be regarded as a guarantee of free of infection, nor be required as a condition to undertake an international travel. Also, we have from early May 2021, the US CDC that has published technical instructions for simulated voyages by cruise ship. Such voyages contemplate the participation of volunteer passengers who can be fully, partially, or not vaccinated against COVID-19. The approach of the US CDC is an example of what is needed, one of the examples. Establishing more robust normative and regulatory frameworks at national level, countries that would receive passengers and international travelers, and including countries of origin of the cruise ships, also clearly defining responsibilities of the national authorities, the cruise lines operators, and also the passengers. And also, this document flags the importance of covering health insurance aspects and other operational aspects, such as potential repatriations. So this is a complex matter, and I hope that my answers have helped to the colleagues based in Miami and the Caribbean to characterize this complex aspect. Thank you.
Gracias, doctor. La próxima pregunta nos llegó de Anthony.
Thank you, doctor. We have a question from Anthony Esposito from Reuters. In English, it reads,
residents of countries in Latin America traveling to the United States to get vaccinated as vaccination campaigns in their home countries struggle. What can you say about this, Dr. Etienne?
So, Thanks for this question, Anthony. We don't have the data to confirm how many Latin Americans are traveling to the US to access vaccines. But we have seen reports about US cities considering making vaccines available for tourists. Let me say that vaccine tourism is not the solution, but rather a symptom of how unequally vaccines are being distributed in the Americas. Vaccines can be the difference between life and death and should not be a privilege of wealthy countries or wealthy people, but I dare say a right for all. Those who cannot afford to pay for international travel, which really it's the vast majority of people in our region, they remain without access to vaccines. And that is not acceptable. And that's why we need to get more doses in every country of our region. And to ensure that those doses are fairly distributed, starting with those who are at greatest risk, like our health workers and the elderly and those with pre-existing conditions. So PAHO is committed to this goal, and we are working through all possible avenues to address the barriers that are preventing more vaccines from reaching our region. We are working with COVAX and manufacturers to get more supplies and expedite deliveries of the vaccines that are available. But we are also looking at other strategies, from encouraging donations to boosting regional manufacturing capacity in the Americas. Given the epidemiological burden in our region and the high mortality of COVID in many countries, Latin America and the Caribbean should be a priority for immunizations to help save lives and to prevent future outbreaks. Ultimately, vaccine tourism aggravates inequality. At PAHO, we are working in the opposite direction. We want to bring vaccines to those who need them, regardless of where they live or how much they can afford. And that's the only way that we will all be safe.
Gracias, doctora Etienne. La siguiente pregunta en el...
Thank you, Dr. Etienne. The next question is from Matias Loel, and it's in Spanish. It says, in India, there have been deaths due to lack of oxygen in the hospitals. The director of PAHO is talking about an unprecedented problem in the availability of oxygen. And do we have a similar situation of lack of oxygen in our region? Dr. Ugarte, thank you. This is a very important and current question. Yes, scarcity of oxygen, but also of other medicines and supplies which are used for treating patients in severe or serious conditions in hospitals is a reality, and there's a great need in several countries. And this happens in those places where there has been an increase in the number of cases within a short period of time, and they have saturated the ability to produce oxygen and distribution of oxygen, and therefore there has been an increase in the cost and availability of oxygen for patients. We have been witnesses to long lines that are happening in different countries, and in many cases we've heard reports that people wait for hours, and in many cases people even leave the line, have to leave the line they've been waiting on for a long time because they are told that the patient for whom they were waiting the oxygen for has died. So in the countries where vaccination has been initiated, the population has a false sense of security and safety, that things are improving and therefore we should do away with restrictions. But reality proves that this is not at all the case. Right now is when we need to be even more cautious, and the lack of oxygen and the lack of other supplies and deaths of patients due to these quick increases in the number of cases are due to the fact that there is an increase in the probability of transmission of the virus from one person to another. The situation in India is a case in point, but it has also happened in Europe and Latin America, and it is happening in some areas in our region due to the dramatic increase of cases. And these cases, many of them lead to deaths. Thank you. Thank you, Doctor. Next question is Manohna Paribatla from Reuters News in English. She asks,
Vaccine production pose a challenge to the supply of other routine vaccines? Dr. Barbosa?
Thank you. Thank you for this question. PAO has a revolving fund that has working for more than 40 years now, providing technical cooperation to the countries to guarantee their access to vaccines, to their routine immunization programs. We are, since last year, we are monitoring, following up with the producers, scanning the horizon of the producers. So far, we have not identified any kind of shortage. We have very producers for COVID-19 vaccines that are not traditional producers for vaccines against the polio, measles, and others, but we need to monitor this very carefully. For syringes, we have noticed that there are some limited access. For this reason, the PAHO's revolving fund for vaccine since last year have started the purchasing syringes to provide them to our member states. So we need to follow up, but so far we haven't identified any limitation due to the production. But it is also important to highlight that for the national immunization programs, this is a challenge because they need now to run the immunization program and at the same time to offer the vaccine against COVID-19. The pandemic produced some severe impacts in many public health programs, and immunization is one of them. The data that we collect from the countries are showing that in 2020, we had a reduction in the first semester around 23 to 24% in the number of children vaccinated against measles and other diseases. So it is very important that in every country, we need to review the data very carefully. We need to identify what are the areas, the neighborhoods, the cities that are lagging behind the vaccination, the routine vaccination, and to establish specific strategies to protect the health professionals, to give confidence in the population that they can receive the vaccine without having any risk to get COVID-19 in crowded health centers or in the line. So this is working. Many countries are already recovering the numbers, and we do believe that this will be a challenge that we are supporting the countries to overcome in this year. Thank you.
Gracias, doctor. Siguiente pregunta es de Aldo Vinolin.
Thank you, Dr. Aldo Vinolin. It is related to treatment in English.
Which is proved to be a specific cure for COVID-19, and which drug is the most effective in treating COVID other than remdesivir? Any updates in treating severe cases of COVID-19? Dr. Aldiguieri?
Thank you for this question, Mr. Binolan. I'd like to highlight that WHO and PAO are updating on a regular basis their clinical management guidelines and are totally aligned regarding the medications to be used for treating severe forms of COVID-19. PAO and WHO are not recommending the use of remdesivir for managing severe forms of COVID-19. And at the moment, no other antiviral is recommended. However, please note that we have randomized clinical trials ongoing for some antivirals and other medications. The set of PAO recommendations for medications dealing with severe cases of COVID-19 focuses on the inflammatory response to the infection, with a recommendation for using corticosteroids, including the dexamethasone. In some cases, immunomodulators are also recommended. So please note that PAO updates its guidelines for clinical management and its review of potential therapeutics on a regular basis. For the potential therapeutics, it's minimum once a month. It means that the state of the art of the scientific evidence is available through these documents, and these documents are posted on the PAO website and accessible for doctors, medical associations, and also the public at large. I hope I have answered the concerns of the journalist. Thank you.
Gracias, doctor. La próxima pregunta es de Noel Miranda.
Thank you, doctor, from Noel Miranda, from Artículo 66 in Nicaragua. And it is how does PAHO assess the work of the government of Nicaragua in caring for the pandemic? And has PAHO followed up the vaccination process in Nicaragua? When will vaccination start for the healthy population? And do you know that you need to be vaccinated in order to leave the country? So, Dr. Ugarte, this question for you. Thank you for your questions, Noel. PAHO coordinates with the government of Nicaragua in implementing the response program to COVID-19. Guidelines and protocols have been developed for response, and also training and technical cooperation have been provided. However, given that the information that we receive is stark, and it comes through the channels of the international health regulations, we cannot really assess the degree of transmission, severity, or other aspects. But so, PAHO cannot truly do an assessment regarding the work of the government in response to the pandemic. Regarding the vaccine, our team in the country office in Nicaragua works very closely with the immunization program, the EPI program in the ministry. We have regular meetings where we see how much progress has been achieved in vaccination, and some assessments are done, and if adjustments are necessary, they're made. I would like to emphasize that during all these conversations, emphasis is made on the fact that vaccination is a public good and it belongs to the whole of the population, and administration of vaccines should be carried out without any regard to things other than the establishment of priority groups. And so vaccination priorities are those who have comorbidities, healthcare workers, and people over 55. But given the scarcity of vaccines, as mentioned by Dr. Barbosa, and also as is well known regarding the limitation in production, Nicaragua is one of the countries that has not received the amount of doses as they expected. So we are all hoping that these restrictions will be lifted and that vaccines can be administered to the whole of the population. We have no information regarding the need of having to be vaccinated before leaving the country. This is a discussion that several countries are entering into right now, but to this point, this restriction is not being implemented, and the recommendations both from WHO and PAHO are that vaccination be not a requirement for international travel or transit or resumption of economic activities. Let me repeat that protection measures that have proved to be effective need to be maintained at all levels, and including Nicaragua, where people who are being vaccinated should still keep their protection measures once they have been vaccinated, because as long as we don't have significant numbers of the population vaccinated, and these won't be achieved for a while, then protective measures should be kept. Next question is from Gisela Salomon, Agencia P. One of the questions is, could we give some update regarding vaccine donations from developed countries to Latin America, and if there are companies that have joined the efforts and are also making donations? Dr. Barbosa. Yes, thank you for your question. Donations of vaccines from developed countries seem to be a very important alternative to respond to the limitation of vaccine supply through the COVAX mechanism, which has happened during the first half of the year. For many weeks, negotiations have been started with some governments, and some of these governments requested that these negotiations not be made public up until the time when they can announce officially, in order not to create false hopes. The first government that has already announced was the government of Spain, and the Prime Minister of Spain, during a summit of Ibero-America at the end of April, announced that they will make donations for the COVAX mechanism, and the vaccines should be directed to Latin America and the Caribbean, and PAHO should be the organization in charge of distributing these vaccines that are donated. So we have met many times with government officials from Spain, and they are aware of the capacity of our revolving fund to make quick distributions of vaccines. There are other negotiations. Our director has sent a letter to the government of the United States requesting that at least those vaccines that are not being used in the United States may be donated. And we are still waiting to hear from the U.S. government, and we are in conversations with other countries as well. Those vaccines from Spain are still pending in terms of knowing the date of arrival or the amount. But this is a good initiative, which perhaps could set the example set so that other developed countries can make donations, so that access of Latin American and Caribbean countries can become a priority. We know that this region is one of the epicenters. We know that India is also now an epicenter, but Latin America and the Caribbean have been severely affected by the pandemic. And if we are going to distribute just based on population, Latin America is at a disadvantage because we have a very limited amount of vaccines for Latin America and the Caribbean if we go only by population. Other countries, Sweden and others, have announced. And this should be a global appeal so that the leaders of the developed world begin to make immediate donations to broaden the capacity to vaccinate the most vulnerable groups and save lives in our region. Thank you very much. Thank you, Doctor. Next question is from Kevin Telmine from the Guardian Media in Trinidad and Tobago in English.
Tobago is going through a rapid increase in COVID-19 spread and deaths. In countries that are politically charged, there is no unifying message regarding the fight against COVID-19. Does PAHO view this as an impediment in countries' fight against COVID-19? What is PAHO's recommendations on how state officials and agencies can communicate to convince a skeptical population to play their part in combating the virus? Dr. Ugarte?
Okay. The issue of information is a critical aspect, and we have seen, unfortunately, that there have been misuse for political purposes or other purposes. We have been seeing that infodemics have caused more harm than even not implementing protective measures. In that regard, we have been suggesting and working with all the governments and all the partners to lead by example, to look at the source, to make their comments and their messages based on evidence. And of course, always look for a reliable source to provide information. And we have been looking also for the reports, for the official reports to be absolutely transparent and easily available, and also to use other media, like social media, for example, to disseminate appropriate, updated information so the population, general population, can reach that information. We have seen that social media is one of the main sources of information for the general population, at the same time that the official reports and the main recommendations are not being used in those channels, but through communication media or official websites, etc. And of course, that does not reach the entire population. So in that regard, this is a call for all actors to provide accurate information, but easily understandable for the entire population, so the population can continue implementing the protective measures. That is the core to reduce transmission, to reduce the deaths, and to overcome this pandemic together. Thank you.
Gracias, doctor. Estamos llegando ya al final de esta sesión.
Thank you, Doctor. We're coming to the end of this session today. The next question is related to the herd immunity and COVID-19. Rachel Court from Nassau Guardian and another journalist ask in English.
Immunity in the region, and what does it mean for the relaxation of measures? Dr. Etienne?
Thank you for this important question and very topical. There is still much that we don't know about this virus, including its threshold for herd immunity. Would it be 70, 80, 90%? We don't know. And this is especially as several different vaccines are in use. We will likely have a better picture once more real-life data from countries that achieve high immunization coverage when that data becomes available. But importantly, I think we must also keep in mind that the emergence of variants makes herd immunity much more complicated. And so that's why throughout the region, we need to focus on reducing transmission to control the number of new infections. And this should be our absolute priority. We can only do this by implementing two strategies in combination. Let me stress in combination. The first is to implement preventive measures. And we've said this many, many times, but we need to say it again. Persons need to observe social distancing, the wearing of masks, the washing of hands frequently, and the avoidance of crowded spaces. This has saved countless lives, and it will continue to do so as long as the virus is circulating. But governments as well. Governments have a role to play. We need to ensure that testing is still widely available, that those who test positive are isolated, that we quarantine, and that we continue to observe some of the measures that governments have taken. Importantly as well, we think that governments should continue to incentivize these behaviors that they want nationals to follow. The second is to expand equitable access to vaccines. While we know that doses are limited, we must first protect our health workers and those that are most vulnerable to COVID-19. As more doses arrive, we will start to see their impact on transmission. When one person is vaccinated, they reduce their own risk of getting sick, but as well the risk to their community. And so that's why it's critical that we all get vaccinated when it's our turn. We should not delay because waiting to get vaccinated prolongs this crisis. These two strategies need to happen simultaneously. As we ramp up vaccinations, it is also important to control the virus's spread through the public health measures other than vaccines. The countries that have ignored public health measures have seen spikes in cases, even after a significant part of their population has been vaccinated. So let's remember that it is the combination of the two approaches, public health measures and vaccines, that will eventually control COVID-19. So each of us has an important role to play. So please, do your part. Thanks.
Muchas gracias, Doctora Etienne.
Thank you very much, Dr. Etienne. And now this is the end of our session today. We have an announcement about tomorrow. You will have received information from our email that tomorrow, Thursday at 3 o'clock, Washington, D.C., there will be a virtual seminar for journalists on the variants of COVID-19. This is a collaboration with Fiocruz and PAHO, and you can also always find information on the pandemic in our website, www.paho.org. Thank you for connecting, and that's it for today.
Thank you for listening to Depictions Media Radio. And welcome back, everyone. So, federal ministers make an announcement on healthcare today, May 12th, 2021. At a virtual press conference, federal ministers Mary Ning, Small Business Export Promotion and International Trade, and Seamus O'Regan, Minister of Natural Resources, make an announcement with the CAN Health Network regarding Canada Healthcare Solutions. You also hear a panel discussion along with this, and the big thing is government is supposed to help us live better. We put them in place so that we can to help us find solutions so that we can live better, do bigger and bolder things. And this particular announcement, I believe, actually does that. We're talking about small businesses being promoted to do big things. So let's listen to what the announcement is with Mary Ning and Seamus O'Regan.
Good afternoon, everyone, and welcome to our virtual event. I'm so excited to have a chance to welcome everyone. We have over 200 people here right across the country, from BC and Vancouver right over to Newfoundland. And so really, really excited to welcome you to this session. So my name is Dante Mora, and I'm the chair of the CanHealth Network. And I also serve as the chief of staff at Trillium Health Partners, one of Canada's largest academically affiliated hospitals in West Toronto and Mississauga. And I have the pleasure of being your MC today for an amazing event. So today we're talking about something really important, and that is how Canada can lead a new healthcare economy, how this country can come together, and how prosperity can be led as we positively disrupt the new industry, creating jobs across the country, but also changing health outcomes. And I think we have a great panel coming up, some wonderful ministers and their comments, and just super excited to welcome you today's session. So while we're talking about this, it's really important that we acknowledge the year that we've had. Everyone in the network, the edges and the contributors, they're all operators. These are all healthcare providers, some large, some smaller, but operators of healthcare that have served in a truly historic moment and have provided care during this pandemic. And I just want to take a moment to thank you and thank the people that you represent. And that's to our operators, but also to our partners in government and all of our different stakeholders in the CanHealth Network. Everyone is doing their work to help Canada be strong. And that's everything from the front line to procuring vaccine and everything in between. So really hats off to all of you. So today we have the opportunity to hear from two ministers, and we get a chance to have a panel discussion with companies and edges, and also announce some really exciting news about the expansion of the network and how this network is driving prosperity, creating Canadian jobs, and helping health outcomes. So it's my pleasure to introduce our first speaker. This is the person who started this. So it started with a challenge from Minister Ng, sort of challenging us to say, why can't Canada lead in economies where they have natural advantage? Why can't we scale our small businesses more effectively? And that was the kernel. That was the start of the concept behind the CanHealth Network. And I've had a chance to watch Minister Ng working in so many different parts. And Minister, I'll pass it over to you for your comments, and thank you for all your support, and thank you for everything you're doing for our country in your many different roles. Minister?
Well, thank you so much, Dr. Mora. Dante, that's a wonderful and kind introduction. And I will echo what you have just said, which is it has certainly been a very, very difficult time across the country, across the globe. And to all of, to everyone who is working in the healthcare sector right now on the front lines, and that is everyone. I also want to echo that enormous appreciation for all of the work that you are doing. I can't think of a time in our history where we've had to bandy together the way we are in an effort to keep Canadians safe, and just a huge appreciation for all of our healthcare workers across the country for what you are all doing. And before I begin, I do want to acknowledge that I'm speaking to everyone from the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, the Chippewa, and the Wendat people. And for those of us who are settlers or even immigrants to Canada, it's important to recognize that Indigenous peoples were here long before us, and that we all have a role to play in reconciliation. I'm thrilled to be here alongside with my friend and colleague, Minister O'Regan, who will be joining us very shortly. And as I was saying to Dr. Mora earlier, along with the rest of the panelists who are with us, that I actually also simultaneously am here in the Parliament of Canada, just through another screen. So if I pause for a moment to vote, that will be why, and that is where Minister O'Regan is right now. We're both doing a little bit of double duty, but we're doing it safely from home in order to do our part in making sure that everyone stays safe during this pandemic. And I'm thrilled to be here with you, Dante, for this really exciting announcement about the CanHealth Network. This past year, as I said, has shown that few things are more important than the strength of our healthcare system and ensuring that Canadians have quality care. And our government is committed to finishing this fight against COVID-19 and supporting businesses and Canadians through this pandemic and certainly into recovery. And while we invest in health services, we are also working to support entrepreneurs and businesses in this health space so that they can bring their innovations and solutions to Canadians. And that is what the CanHealth Network and the integrated market is supporting. High potential companies to access billions of dollars of procurement spending and to bring those innovations, those technologies, those solutions into our healthcare system. And not only is this helping businesses in the health sector to scale here at home, the CanHealth Network anchors the experience and the talent of these businesses that are growing here, that are scaling here, and they're anchoring it here in Canada so that they're set up to succeed. Because when they grow here in Canada, I'm the small business minister, but I'm also the international trade minister. So getting businesses growing here, anchored in Canada, and helping them grow into the international market is what this integrated market is really helping our businesses to do. So in Ontario, CanHealth has already connected 12 healthcare organizations to launch 10 projects with 15 businesses aimed at providing solutions for healthcare challenges. A great example, who you're going to hear from very shortly, is Can Immunize. It's an Ontario-based company, and they're with us here today. Can Immunize developed a digital tracking system for mass COVID-19 vaccine rollout, which is now successfully being used to schedule appointments for vaccinations across Nova Scotia. And then there is Precision ADM, a Manitoba-based company that is currently manufacturing N95 masks here in Canada, made with materials from Alberta, and the CanHealth Network is helping them to sell across the country. These projects are terrific examples of CanHealth's integrated market, helping our small health solutions businesses sell and to scale their made in Canada solutions across the country. And in doing that, also getting them ready to export into the international marketplace, which really brings me to today. To continue to build on the success of the integrated market, I'm very thrilled to announce an additional investment of $3.25 million to CanHealth's network here in Ontario. I'm also very excited to announce an additional investment of over $2.2 million for the CanHealth network to expand into Atlantic Canada. In Ontario, this top-up funding will allow CanHealth to support an additional 10 innovative technology firms as they work together to bring their solutions to market. This expansion means working with the healthcare providers in New Brunswick, Newfoundland, Labrador, Nova Scotia, Prince Edward Island to support Atlantic health technology businesses so that they can bring their innovative solutions to the Canadian market. So over the next 2 years, this integrated market will connect healthcare organizations with promising Atlantic businesses to bring new cutting-edge solutions to the Atlantic health system while unlocking the potential of these incredible innovative businesses to sell their solutions not only in Canada, but indeed abroad. So simply put, the CanHealth Network supports the Canadian healthcare system while ensuring that Canadians are the first to benefit from the incredible made in Canada health innovations, the technologies, and the solutions. So today's announcement just really increases this progress, and our government will continue to put the health and safety of Canadians first as we finish the fight against COVID-19, and we will continue to support our businesses throughout this economic recovery. I'm really looking forward to seeing new health innovations that are getting developed, that are going to be adopted and nurtured through the CanHealth Network. And through the work of the CanHealth Network, you're going to scale them in Canada. And when you do that, you're going to help those Canadian companies scale in Canada, and we're going to work together so that we can bring them into the international market. So I'm going to give the floor back to Dr. Mara, who will introduce who will, I think, introduce the panel because I think Minister O'Regan is still in the Parliament. And while he does that, I'm actually going to vote. So you'll actually see what I do in voting, which really is putting up my phone to me so they can recognize and register my vote. But to that, merci beaucoup. And I'm going to throw this back to you, Dante, while I pause very, very quickly for a vote. But please continue.
Okay, awesome. Thanks so much, Minister Ing. And I can feel and sense your passion for Canada, for scaling our small businesses and for creating trade and the many things that you do. And that's what this is all about, an integrated market that brings over $30 billion of purchasing power to a marketplace to scale our great Canadian companies across the country and get them ready for international scale as well while solving problems. So I'm going to pivot a little bit. That's been COVID and in the agenda. And I'm really excited actually to introduce the lead edge of the Atlantic. And so one of my favorite parts of being a part of this is you actually meet all these special people across the country that you normally wouldn't get a chance to meet. And Jennifer Shields is one of those critical people. This is someone who's a passionate Canadian, a leader in her work. She's a chief information officer at Horizon Health, but just a spectacular leader. And is our lead. Horizon Health has taken a great leadership role in the Atlantic region. We're so excited, the energy coming and on the opportunity in this area. And Jennifer's already in Horizon Health, has already actually led our national RFP with multiple different provinces. So Horizon has already done some great work and some amazing work happening out east. So Jennifer, I'm going to pass it over to you. We're so excited about the launch of the Eastern segment of the network. And over to you, Jennifer.
Well, thank you. And hello, bonjour. Thank you, Dante. Thank you, Minister Ing, for those remarks. And thank you to everyone for being here today. We are so very proud to be serving as the lead edge for the expansion of the Can Health Network here in Atlantic Canada. This is a really big day for healthcare innovation in the Atlantic region. And speaking on behalf of our member edges, I know we're absolutely thrilled to be a part of this and can't wait to get started. We are a small but mighty community in the Atlantic, and each of our EDGE members bring an immense amount of knowledge and passion and experience to the table. We also bring some very unique expertise to the Can Health Network. We represent a diverse spectrum of healthcare specializations across a few provinces. So looking at our partner EDGE organizations here in Atlantic, we incorporate acute care and primary care with the various regional health authorities. So including Horizon, we have Vitalité Health Network, we have Eastern Health in Newfoundland and Labrador, we have Health PEI and the Nova Scotia Health Authority. We incorporate specialized tertiary care services with partners such as the IWK Health Centre in Nova Scotia. We incorporate long-term care with partners like Shanex. And we incorporate home care, paramedicine, and emergency medical services with partners like Medavie. We're also really proud to include our first French language EDGE partner to the national network. So bienvenue à la Réseau Santé de Vitalité. We are already a very tight-knit group of healthcare providers, and we share common challenges and objectives. So our inclusion in the Can Health Network will only strengthen these bonds. And I must say that the expansion in the Can Health Network would not be possible without the support of our funding partners. So I'd be remiss if I didn't offer sincere thanks to the Government of Canada, including FedDev and ACOA, for recognizing the value of this outstanding initiative. And of course, I'd like to recognize Minister Ing, and I know Minister O'Regan will join us, but their continued support of this partnership for being here with us today is really much appreciated. Together, we look forward to rolling up our sleeves and forging new connections with innovators in our region and beyond to bring leading edge solutions to the marketplace. There is already a really robust ecosystem of innovation that exists here in Atlantic Canada, and I know we're ready to hit the ground running and drive this process forward. Today is certainly a cause for celebration. And again, speaking on behalf of our Atlantic team, I'd like to thank Can Health for formally welcoming us into their network. Thank you to Dante and your team for working with us so collaboratively over the last year, bringing us to today's announcement, and for everyone who's had a role in making this possible. We can't wait to share some of our Atlantic success stories in the months and years ahead. So thank you all again, and merci.
Thank you so much, Jennifer, and we're really excited for the success that will come out of the East. And today we're highlighting projects from Manitoba that have gone to Ottawa and projects from Ottawa that have gone to Nova Scotia. And we're super excited to highlight the work that you've done in the national RFP crossing the entire country, and really excited for the next steps and the work that you're doing. There's 8 new edges coming, and I think Jennifer described them across all the different provinces, but they actually add to the network. We don't have a transport partner right now in EMS, and that actually increases our exposure, and also with Shanix. So lots of new opportunities for integration and to power the integrated market, and we're super excited to work with you. So welcome, and I'm really excited for the results that will come. I'm going to pivot a little bit, and we're gonna start moving into the panel. But there's a couple just things I just wanted to comment on. So, what is most inspiring as we do this? It's the results, right? So we have AI companies and natural language processing companies like Semantic Health working with groups like Sick Kids and on coding, and we're going to be really excited to tell that story. We have edges like Beare in Ottawa that have been truly leading multiple different projects, and you're going to hear about the Can't Immunize work. We have Saskatchewan Health Authority that's been doing great work leading in the West, and some great projects there. And it's what's been so neat is to watch their response right through COVID operationally and leading the country in many different ways, and their leadership in the network. And we have many partners who have been with us from the beginning. So I have to just take a moment to thank our public officials at FedDev, WD, and ACOA. This has been a creation of many people. It's been with companies, it's been with edge partners, it's been with regions, but it's also been with our regional development agencies. And they have co-created this with us. And this is really the first project that you've seen the regional development agencies working across the country. And I believe the first project that WD funded 4 different provinces simultaneously. It's showing the willingness to try new things and to create this integrated market. So we've had lots of time with our officials in many different areas. And thank you to ACOA, WD, and FedDev for just the tremendous work that you've done. Another partner who's been with us from the very beginning is Deloitte. So Deloitte has been an amazing partner and sponsor. They're obviously an amazing consulting company that works across the country and with many of you as operators and everything from strategy to operations. And they're really been focused on the Future of Canada project, which they have a great report. And I just want to take a moment to thank Deloitte. They powered our AGM, which was a great event bringing Canada together, but they're also powering us in many different ways. So huge hats off to our partners at Deloitte. So we're going to, Minister Reagan isn't here yet. So Minister Eng, I think what we'll do is we'll move into the panel, and then I will give Minister Reagan a chance to comment at the right time. He's been a huge, passionate Canadian. I loved getting introduced to him through Sheldon Levy, who's been a bit of an architect of the integrated market, and his passion as our Minister of Natural Resources, a champion of Atlantic Canada, but also just a Canadian champion of business and integration across the country. So we'll give him a chance as we move into the panel. And I'll now introduce our panel participants and move into this stage. So the first person I'd like to introduce, we heard about Can't Immunize, is Dr. Kumanan Wilson. Kumanan was someone who was actually very early on in the Can Health Network's conception and early thinking. He's an internal medicine specialist at the Ottawa Hospital. He's a CEO of Can't Immunize, an amazing Canadian company that we talked about that created Canada's first digital vaccine record. And Can't Immunize partnered with Beare, one of our edges in Ottawa, and has recently started scaling and helping on COVID vaccination in Nova Scotia and I believe the Yukon. Cool moment. So Trillium has done about 200,000 vaccines as a vaccination center. And there was a moment where I saw a nice tweet from an Ontarian saying, I booked in Ontario and I booked in Nova Scotia. Nova Scotia is way better. And the experience has been way better. Why can't Ontario do it like Nova Scotia? Well, that's because they have Can't Immunize. So not to take anything away from the COVAX system and our partners, but Canada technology can compete with Salesforce. Our next panelist is Jay Singh. So Jay, great story, has spent a lot of his career in health innovation on the procurement and supply chain management. And he's been critical during the pandemic. And he's joining us as the Chief Commercial Officer for Precision ADM. Another story of a scaling Canadian company right in the effect of helping with COVID. Jay will tell you the story of Precision ADM, but coming from Shared Health Manitoba. So our Manitoba edge, super excited about this scaling out to the Beare area. And I'm super excited. Welcome, Jay, to the panel. And finally, we had a chance to hear from Jennifer, who you've met, but just an amazing executive with over 20 years of experience in leadership and information technology and communications. So with that, I'll pass the panel over to you, Minister Ng, and when Minister Reagan comes, we'll introduce him. Over to you, Minister Ng.
Well, thank you so much, Dante. And I can tell you, he will join us. I think he'll join us. I think there's one more vote left. I just, when you see me do this kind of thing and move it around, it's because I was voting. So I managed to get that one in before we started the panel. So let me get into it. This is absolutely fantastic. I love the opportunity to have Dr. Wilson with us, to have Jay with us, to have Jennifer, and you, of course, Dr. Mara, and I think everyone will learn a whole lot from this wonderful conversation. I always do. But, Dante, you and I had this conversation some while ago about the Can Health Network. You, of course, you're the chief of medical for Trillium Health Partners, and that is it's a big institution. It's a big organization. It's one of the largest community-based hospital systems in Canada. You're also a specialist in internal medicine. You're also an assistant professor at the School of Medicine at U of T. So I would dare to say that you are a busy person being a doctor and being the chief of medicine. But yet, when we actually had the first conversation, you had actually said to me how important it is and what the opportunity is, because you do actually see made in Canada. You do see the innovations and projects. And I don't even want to call them projects because they really are businesses. They're businesses and they're innovations that come to your door. But what could you actually really do with them as the chief of medical, even at a very large community-based hospital? So last year, the Can Health Network ran 18 commercialization businesses, like business projects during this global pandemic. What has been the most significant part of this journey for you?
Yeah, so thank you, Minister. And I think there's probably a couple of things that I'll highlight. So the first is that this is about results. This is about creating an integrated demand marketplace that's bringing purchasing power and is scaling companies. It isn't about creating a video. It's not about creating a research paper. It's about scaling Canadian companies. And we've completed 10 projects of the 18. We now have 22 edges, and 80% of them have been successful. So that's scaling internationally, scaling across the country. So it works. So we can take an edge in an environment, identify a problem, attach a company, show that it works, and scale it across the country. That's what matters. It's about prosperity. It's about jobs. It's about actually using the demand marketplace. That's really, really important. The second part is uniting the country. So this is rare. It's rare to have healthcare operators from all across the country working together to create jobs that start in Newfoundland with a company that gets access to the Ontario and Alberta and BC and Manitoba marketplace. So the jobs stay there and then they grow. And that's what's been really amazing about this. As we've met different people, every month the edges all come together to talk about their projects. And that's helped in everything from COVID response and us sharing knowledge, but bringing the country together to create a marketplace that has the buying power of California. That's what you need to create global Canadian companies. And it can be done. We've done national procurements. The edges are procuring and moving forward. And then the third piece is, fundamentally, this is about prosperity. If Canada doesn't lead and create a prosperous country and lead new economies like healthcare, space, agriculture, manufacturing. There is no prosperity for the social values that we care so much about. It is necessary. This is absolutely essential that we don't become the blockbuster that gets disrupted by other groups. We have to lead that. And I think what we've seen is not only can we create scaling companies, that we can bring this marketplace, that we can bring the country together, that there's shared learning and teaching, but actually it works in health outcomes. So whether it's Maple with virtual care and long-term care, I know 50 people that would have had bad outcomes or died had they not had that technology. It's amazing that Maple is creating prosperity. That's the goal. Saving lives is the outcome that comes from that. Can Immunize, we talked about that as part of the response to COVID. We have Precision ADM who will talk about COVID. Verdo, which is powering many of the vaccination centers here in Ontario. These are not just technologies creating jobs. This is actually life-saving medicine in a different way. So it's those four things. Results, it can be done, bringing the country together, creating prosperity in the future of the country, but fundamentally, we can positively disrupt healthcare, and it can be better for all. And it's been a collaborative effort. We have learned from every edge. Every group has had their DNA in this. And it's a made in Canada solution and regionally led. So I'll pass it back to you, Minister.
Well, Dante, thank you so very, very much for that. And I couldn't agree with you more. The approach that our government has taken throughout, and certainly during this pandemic, has absolutely been a Team Canada one. And when I describe my job, I'm like, okay, I'm the Minister of Small Business and International Trade, but you know what the job really is? It's the Minister of Startup, Scale Up, and Access New Markets. Far too often, I was seeing companies who were finding it difficult to really scale here in Canada, and certainly in a sector like the one that you are all a part of, which is the healthcare sector. There's such incredible innovators and solutions and technology and processes, and we are going to hear from a couple of them very shortly. And that's essentially, as I said earlier, how do you help these companies actually get into what is the Canadian market and the Canadian innovation? And this question is to Jennifer. You have been, you've spent your career in the IT sector, in both private and in the public sector, and you're at Horizon Health Network. And here on the one hand, we've got, we saw a bunch of Canadian companies looking to scale and essentially get that big customer, work with using their Canadian innovations in a Canadian setting so that their solutions are benefiting Canadians first, and in the course of that, growing. So my question to you is exactly on the side from an edge or edges from the healthcare organizations. What advice would you give to the health organizations who you now are essentially sort of working, sort of bringing into this Can Health Network as they need to consider adopting these very technologies, these very innovations, so that, as Dante said, it is disrupting healthcare positively, but doing so in a way that also will yield the best benefit to our Canadian innovators and businesses?
Well, I like the word disruptive in that it's positive disruption. So in my experience, I guess I'd have to say that a key success criteria is, as a healthcare organization, we need to embrace a culture of innovation and change. Typically, we tend to be quite risk adverse, and rightfully so. We always focus on patient safety, quality care, good patient outcomes. A lot of what Dante had articulated in his key message, that is some of the outcomes that we're realizing through this network. I know that in traditional healthcare organizations, when you consider embracing innovation, sometimes it is perceived as a negative disruption. We need to change the narrative on that. My advice would be to ensure in the organization strong guiding principles are in place, remind stakeholders that the clinical needs drive the technology and not the other way around. Digital transformation and technology adoption always needs a champion, someone who's clinically active, who's influential, and can help ease concerns or fears about change. I would also say that as an organization, we need to also consider that a reasonable level of risk might just be okay. I think our response to COVID-19 is a really good example of this. When we're faced with new challenges and time constraints, your decision-making criteria adjusts accordingly. And I think that's where the concept of positive disruption comes into play.
Well, thank you so very much. Just connecting sort of that dot back on the point that you made, which is, which I love about this. Dr. Mora, as I said, you're chief of medical for one of the largest community-based hospital systems in the country. And so you're a medical professional. And my next question is to Dr. Wilson, who also is a medical professional. But having the Can Health Network essentially, be co-led with the healthcare providers on the one hand, but taking on an active responsibility with those who will play a part in that positive disruption to get to those outcomes that you all care about and that communities care about is really what this network is. And Dr. Wilson, I had read that the catalyst for Can Immunize came from a conversation with a mom that you had in Ottawa Park. And it was over the frustration of the yellow immunization card, which sparked this idea for you. And maybe now is a really great time for you to share with everyone, what is Can Immunize? And what were some of the biggest barriers or challenges that you have faced getting it into the market? And how did you overcome it? Because I think your story, this experience, is the practical reality of a solution, but a solution to get into something that really becomes a solution, and then one that is a solution that can actually have broad application.
Thanks, Minister Ng, and thanks to you and Dante for your leadership and vision on this amazing project. So this has been quite a journey for us, and we appreciate all the support along the way. So also congratulations to the Atlantic. I'm from Fredericton, New Brunswick, so I'm a proud Maritimer. And actually, ties back to the origin story of Can Immunize. It actually happened after the last pandemic, after H1N1, when I did have a conversation park with another New Brunswicker in Ottawa from the Miramichi. So New Brunswick is a really important part of this. And she did say, this is ridiculous. I can do a lot of things on my phone, but I have my paper records. And then that prompted us to develop what would be a first of its kind solution, Immunize On. And we kind of knew it was a first of its kind solution because Apple contacted us and said, we've been waiting for someone to develop one of these. It seems like an logical application to build. And then from that moment, it started to get traction, and the federal government saw the value of this to help Canadians connect with their immunization records and take control of their own health information. And we've been generously supported by the federal government over this time period. So this is an example of how a federal investment way ahead of the rest of the world. The federal government invested in digital immunization records, over the last 10 years. And it puts us in a good position coming into this pandemic. And it allowed us to develop this application and make it Canada-wide in both official languages across all platforms. And over the last 10 years, we've had the great opportunity to work with our public health officials across the country and our local public health officials. Like Ottawa Public Health has been amazing in allowing us to pilot solutions. So I think that's an important lesson we've learned, working with people on the ground and recognizing the value they bring and understanding what the actual problems are. But about the beginning of last year, we realized that this isn't really a research project anymore, as Dante would say. This is more than research right now. And maybe the home for it wasn't the hospital. So we spun out and we took control of the product for probably the beginning of last year. And then 2 months later, the pandemic hits. And suddenly we're in this situation of where we have a solution that we realize is going to be needed, but we were a 5-person team, a brand new startup. And how were we going to get ready for what was to come? But one of the advantages of doing this for the last 10 years is we knew what problems were going to be coming. We knew what type of solutions needed to be built based on our experience. So we started to build a solution for influenza vaccine campaigns. But we needed a partner. And it's hard for a hospital to take a chance on a small company. If something goes wrong, they're going to get blamed for it. And we needed a partner who had a forward-looking vision, recognizing the role of innovation and digital technologies, and Beare was that partner. And they deserve a lot of credit for what has ensued. But they also needed support as well, and that's where Can Health comes in. Through the support from Can Health, you de-risk the project and you support them. Hospitals have a lot of competing priorities, and they do need this type of support so that they can take a chance on a smaller Canadian company. And it's a combination of a hospital willing to take this risk and the support from Can Health that allowed us to co-design this with Beare. And the co-design was important because we didn't realize booking was so important. It was Beare that said, oh, we need a booking part of this. And that turns out to be one of the key elements of the solution we built. So it's a problem one. Anywhere, but we didn't have a ton of expertise in the business side of things, and Can Health has been very supportive of that. They provided the mentorship and helped us learn how to develop and build a company. So I think those were the three of the major challenges we faced, and we had the support because of this program, and it allowed us to develop a solution we're very proud of, and a solution that's helping Canadians through a very difficult time. And I know for my team that's really important. So thanks to everyone here.
Well, thank you so very much for that. I wish that I wish these sessions were a lot longer because there's a lot to sort of to drill in there. But if I would say one thing, the experience that you have just charted and shared, I could say that it is replicated in many folds, because I've certainly heard that along the way, and very, very thrilled about the work that we are doing really as a whole of Canada approach here. Maybe what I'll do now is I will go to Jay, to you, and your company, of course, is Precision ADM, and you are I'm not going to pretend to try to describe the company. So I'm going to actually just say here, maybe I'll have you do that. But the question really here is there anything particular that you had or you didn't have in this past year that would have helped your company succeed?
Well, thank you, Minister Ing and Dante, for your leadership, and Can Health to provide us this opportunity to really a little bit tell about our company. So for context, Precision ADM is an advanced digital manufacturing company. So we are the people who make metal 3D printed parts for implants. We are in people's knees and ankles and hips. And then we are on International Space Station. So everything in between we play in. So from bodies to all the way aerospace, turbines, and everything else. And we worked in this niche sector from last 5 years. We come from Orthopedic Innovation Center. This was where Precision ADM was created out of a nonprofit organization, very small SME based in Manitoba, and very, very innovative technology we were able to bring to the market. We were probably we were able to connect with the federal government and provincial government to provide them the solution. But then CanHealth opportunity came along where Shared Health Manitoba, CanHealth, as well as Government of Manitoba, challenged us into a solving Canada's N95 mask problem. So our challenge was to build a reusable N95 mask, which we can use again and again. It has to be environmental friendly. It has to be super comfortable. And it's need to protect our frontline healthcare providers in a much more stronger way than any disposable or those paper masks were doing. So we got challenged by this group, and our innovative engineering group went to really to the beats to really redesign a healthcare grade N95 respirator. And I'm proud to say that we were the first one in North America to build a healthcare grade reusable N95 half mask respirator. And since we were part of the CanHealth supported us as a small company to really take us to the next level as an edge partner with Shared Health, and supported us with the fit testing, deploying, and commercializing the product first to the initial to Manitoban market. And when we were highlighted on CanHealth's different webinars and seminars, and other edge members jumped in from Ontario. Beare Kingston is another one, and few hospital in Trillium there. So SNV found ourselves becoming this Canadian company, which was booming in a very, very fast situation. And now we have a solution, a Canadian solution, which is, I think we have solved the Canada's problem for N95 forever. And it's have done a tremendous job for us. We became a very strong company financially, as well as employment. We went from 30 employees. Right now, we are at 170 employees. Probably by end of the month, we're going to be 200. We have jumped into multiple PPE sector business because we've seen other opportunities along the way, which got exposed to us. We are now in Quebec. We are manufacturing in Ontario. We are headquartered in Manitoba. Now we're looking into Alberta. And with this marketplace opportunity Dante and team have created for us, it's tremendous. There hasn't been this kind of opportunity available for Canadian entrepreneurs prior to CanHealth initiatives, because healthcare, as Minister you mentioned earlier, it is very close knit. It's close knit by GPOs and contracts and so on. Canadian innovators, it's very, very difficult to get into this healthcare stream. But what CanHealth have done for us is really put us on a map. We are now being contacted by U.S. firms to participate into the U.S. opportunities and other. From South Africa, tomorrow I'm having a call with South Africa, and in the UK and others. So it is, I am just so grateful we got this opportunity, and we have changed it into a Canadian innovation highlight for all of us. It's the, I'm a proud team member of this team who have delivered this tremendous innovation. I think overall I think in the upcoming our innovations and other scenarios, we definitely will be engaging with CanHealth and expanding our opportunity and partnerships with CanHealth and Dante's team in much more cohesive ways. And Mr. O'Regan have joined us. Dante, over to you first.
That is absolutely wonderful, Jay. I love all of that because remember, I'm the Minister of Startup, Scale Up, Access New Markets. Guess what? Your company has started. Your company has scaled up through CanHealth, and your company now is accessing those new international markets to which Canada has free trade agreements with. So that's absolutely terrific. But with that, I'm going to throw it to Dante because, hi, Seamus. You're on mute.
Unmute me. There we are. How are you?
I'm good. I think Dr. Mora is going to introduce you, and Dr. Mora is running the program, so I should stop talking.
I was about to say, it's hard to MC this group. So Minister, we've heard some great success stories from some Canadian companies of how they've, scaled from Manitoba with Alberta products to Ontario and elsewhere, and from Ontario to Nova Scotia. Lots of success in changing outcomes, creating jobs, prosperity. And I had the pleasure of meeting you through Sheldon Levy and some of the work that you were doing out in the Atlantic provinces and with Newfoundland. And you're an incredibly proud Canadian, passionate about Atlantic Canada, about Canada. And as our Minister of Natural Resources, it's a pleasure to have you speak to us. And this is the Can Health Network, and to make some comments. So thank you so much for joining us, and I'll pass it over to you to make some comments.
I am speaking to you. Thank you, Dante. I'm speaking to you literally just coming out of the House of Commons, where we had votes, and I was holding down the fort there. So I won't be long, but I will be incredibly candid because I have no notes prepared here. Let me just say, first of all, Dante, you made quite an impression here in St. John's when you spoke at our tech summit. We have a burgeoning tech sector here in St. John's that I have keenly been interested in ever since I went to Ireland almost 30 years ago to study the Celtic tiger back in the day, and to see how a country very much like my province here in Newfoundland, what were the similarities? What could we be doing? What structures could we put in place to leverage the talent pool that was there? The Irish have figured out a whole bunch of ways to do that. But you and Sheldon and Mary and the rest of the Can Health team, you guys have figured out how to leverage one of Canada's great institutions, which is our public health system. And how do we leverage that to build technology and to build startups? And it is almost deceivingly easy when Sheldon first explains it to you. It is far harder to put it into place. That still requires a lot of hard work and determination. But Dante, I can tell you, for whatever it's worth, having the minister in charge of, you just gave yourself a new title, Mary, which I really quite liked. But having all you do, I don't even do. She doesn't need a title. She doesn't need a title. Minister Mary Ng. That's all you need to know. That's Prime Minister. That's what he knows. And I'm, as the Minister of Natural Resources, we are fans of you guys. We are fans of Can Health Network. We are very keen to see a beachhead here in not only in Newfoundland and Labrador, but also in Nova Scotia, New Brunswick, PEI. We're going to go. It's going to be really interesting to see how this country changes over the next few years as we come out of this pandemic. One of the things that's very interesting, I think, and Ireland suffered the same problem, is that we're a nice place to live. But, I lived in Toronto for 15 years. I lived in New York for 3 years, lived in other places. But the quality of life here is really quite good. And if I can do what I want to do and realize my dreams and grow my business in this place without being hindered in any way, you may see more and more people move to smaller jurisdictions like mine. And I can tell you, that's the kind of assistance and help and growth that we want to see in these provinces. Nobody wants to get a check for doing nothing. People want to attract talent. They want to build businesses. They want to grow economies. And it floors me every time, Dante, I listen to you speak, how, as I said, how deceptively simple this is, but how incredibly smart it is. It is so smart. And I'm seeing people who are moving back here to this province who are my age or a little younger and want to raise their families here and know now that they can do business here. And as long as we can provide them with the access to capital and the access to market, let them do what they do. Let them grow. Let them help grow our great country. So that's it for me. Thank you very much for your patience. And again, I'm very sorry I'm late. I was looking forward to this all day, but democracy keeps getting in the way with its voting and stuff. Anyway, Mary, back to you.
Well, I was voting here because I had the benefit of another screen, which, by the way, also sort of took up how to how to do that piece of it. It was incredible, but it all worked.
I don't have the nerves of steel that you do to conduct a meeting and vote at the same time. I swear, like I don't know what happened. I'm not capable.
Well, I was
as usual. I admire you.
I was telling the audience, I said, excuse me if I lift up my phone. It's not because I'm not paying attention, but I actually am voting in the House of Commons. So, doing that too. So anyhow, I'm just taking a look at time here. And I've got one final question to all of the panelists. We're on that road to recovery. The government of Canada released a budget, a very ambitious budget, a couple of weeks ago. This is about finishing the fight against COVID-19, getting Canadians back to work, getting on that road to recovery, helping our businesses, helping women return to the workforce with a $30 billion investment in affordable early learning and childcare. So a range of investments. So of course, a lot of our work is very, very much focused on finishing this fight and also on that road to recovery from COVID-19. So here, it's a pretty broad-based question. I mean, it'd be wonderful to have your perspective. But what do you see? What role do you see CanHealth being able to play supporting Canadian businesses in this economic, in this road to recovery, and what benefits do you see for businesses, but also for the healthcare institutions who I know through the CanHealth network are really, really excited to be a part of this journey as well. So maybe I'll start in Atlantic Canada with you, Jennifer, and then I'll move along.
Sure. Well, I appreciate that. Thank you. I think the reality is that COVID has taken us off a course we were on. The problems we were experiencing, the challenges we had haven't gone away. In fact, they've probably grown exponentially as a result of all the new challenges that COVID has brought forward. But here's the opportunity, and here's what's very exciting for me, and I believe for my partner organizations. Now we don't have to solve these problems alone. Our challenges are very common from one healthcare organization to another. Now we can collaborate to understand who has the ability, the capacity, or the partners. Maybe you have a local incubator or an accelerator that you can leverage, like Minister O'Regan had mentioned in Newfoundland. Exceptional relationships already exist in these ecosystems that we can actually partner and launch these projects to say, can we address this? Can we find a solution that's Canadian grown, demonstrate that they prove to meet our needs, and help to partner so that they can actually grow across Canada? These problems aren't going away. So I'm really excited that we don't have to face these challenges alone. And for me, I think that's the exciting part of all of this, that we're going to be able to table our collective priorities, understand who's ready and rolling up their sleeves to lead these projects and getting them underway. And it's a very exciting time for us.
Yeah, I think, Minister, and I've been asked to close, but couple comments. You have the solutions right here. When Canada unites to create integrated demand marketplaces that can scale Canadian companies, and they can go to the rest of the world. Jay's talked about it, talked about how he's solving a real problem in Manitoba with Alberta products, hundreds of jobs being created in Manitoba. And Mr. Reagan, the talent of Atlantic Canada, the talent is there, and it gets access to a $30 billion marketplace, 30 million lives, size of California, and scales. And our country gets small and focused, not just on recovery, but in reinventing itself. Because it's not about looking back, and we can be better. We can come through this stronger. The government is investing, and we have to be forward looking in how we do that. We've highlighted Can Immunize. There's companies just like Virto. Virto is a great Canadian company that is helping us on our immunization in Ontario and elsewhere, on the St. Joe's Edge in Hamilton, working across Ontario. The solutions are here. The talent is here. And so We're going to make you really proud through Can Health and show how it can be done in health. And Mr. Reagan, we're going to do it in sustainability. We're going to create an integrated market in sustainability and in agriculture. There's a future space industry that Canada should lead. The bottom line is we need an environment that uses the purchasing power of this country to unlock the potential of this country. And that's simply what the integrated market is. And that's what you started. And your challenge, and this is the country coming together, launched in Vancouver, Saskatchewan Health, Manitoba, BC, Alberta, right across this country. And we're so proud to announce the Atlantic component of it. And we're so thankful for your support and the support of everyone who's been a part of this. So this is the beginning of a railway that will extend elsewhere, which will make this country small, prosperous, bring new ideas, and create many, many companies. And Precision ADM will be buying up companies in the US, just the way that Point Click Care did in Mississauga. They bought up the American competitors. They're the global leader, $4 billion in purchasing power. That's what this is all about, to solve real problems. And we can make this country small, and the jobs stay where they start. They stay in St. John's because they get access to the global markets. And that's what it's all about. So thank you for your support, all of you. And thank you to everybody who joined us, because this is the beginning of where we're moving towards leading a new healthcare economy, but really about reinventing how the prosperity can power the rest of the country. So I know I'm supposed to pivot a little bit here, and I know there's some media that may be wanting to ask some questions, and I'm to pass it over to Yomi Han, who's going to help us do this next segment. Thank you to everybody who joined us. Thank you for your participation, and thank you to all of our edges who are powering the network as we move forward. So with that, I'll end the formal event and move us into the next segment. Have a great rest of your day.
This show has been produced by Depictions. Thank you for listening to Depictions Media Radio. Welcome back, and we're about to join President Joe Biden. He is doing a lot of things to help promote a better United States, one that supports people better, and he's about to make an announcement about more programs to help get people vaccinated and to help get the United States out of the pandemic situation. So let's listen to what Joe Biden actually has to say. Thank you.
Good afternoon again. Tomorrow we'll cross 250 million vaccine shots administered since it took office. I think it's a pretty consequential achievement for the nation. I promised I'd keep you up to date every 50 million shots. Today I have an important update. Last week I launched a new phase of our vaccination program. At that time I set two new goals for our country. The first was getting 70% of adults their first shot by July the 4th. The second was having 160 million Americans of all ages fully vaccinated by that same date. I'm pleased to report we've made strong progress on the adult vaccination efforts in just the past few days by making it easier than ever to get vaccinated. You can visit vaccine.gov or text your zip code to 438829 to find a vaccination site near you. And we're also opened up thousands of federal pharmacy sites to vaccinations without appointment, so people can just walk up and get the shot. Now, more employers than ever are giving people time off as well to get their shots. More grocery and retail stores and sports teams are providing discounts and promotions to encourage customers and fans to get vaccinated. I talked to a bunch of governors yesterday. One of the governor of Maine points out that if you're a hunter or a fisherman in Maine and you want to get a license, no problem. You don't have to pay for it if you get your vaccination shot at the same time you get your license. Whole point is there's a lot more convenient places for people to get their vaccine shot. From May 24th to July 4th, Uber and Lyft, and I think it's incredibly generous of them, are going to offer everyone in America free rides to and from vaccination sites. So go online, find out where the vaccination site is, call Uber or Lyft. They will take you there, wait for you, and take you back. As a result, even though more than half of the adults in the country have already gotten their first shot, we have fewer people who need to be vaccinated than ever before, and we're actually seen a slight increase in the pace of vaccinations across the past week. And we're now on track to hit 60% of adults with at least one shot by next week. We still have a lot of work to do to get the adult vaccination rate to 70%, but I believe we're going to get there. So today, I want to talk about an exciting new development. When I spoke last week, I said we were hoping to soon add a new element to our vaccination program: vaccinations for adolescents ages 12 and older. And then on Monday, after rigorous, thorough review, the Food and Drug Administration, the FDA, authorized Pfizer vaccine for use in that age category, 12 and up. Today, an independent advisory committee to the Center for Disease Control and Prevention, the CDC, voted to recommend its use. Now, pending the CDC's final approval later today, we're going to have for the first time a safe and effective COVID-19 vaccine for adolescents over the 12 years of age. And this is one more giant step on our fight against the pandemic. I sincerely think the scientists, researchers, and clinical trial participants deserve our thanks. They've all made this possible. Because of them, nearly 17 million more Americans are eligible to get vaccinated, and now, I encourage each of them and their parents to get their vaccination shots right away. And here's why. We know that kids at this age, 12 and above, are at risk from COVID-19. About 3 million COVID-19 cases have been reported in kids under 17 years of age. And teenagers can spread it to their friends, to their siblings, to their parents, and to their grandparents. Now, that vaccine is authorized for ages 12 and up. And I encourage their parents to make sure they get the shot. As I promised last week, we're ready. This new population is going to find the vaccine rollout fast and efficient. As of tomorrow, more than 15,000 pharmacies across this country will be ready to vaccinate this age group. Most of these pharmacies are close to family as their family home, as the kids' school is to their family home. We're also going to be getting vaccines to pediatricians and family doctors, so parents and children can talk to their doctors who they trust about getting the vaccination, and they'll be able to do it at that office. We're also partnering with school-based clinics and community health centers. Of course, we remain focused on equity in our vaccine program. The vaccine is free for everyone, free. Additionally, if teens are on the move this summer, they can get their first shot in one place and a second shot elsewhere. And at the same time, we're also launching an important public education campaign. First and foremost, we're providing families with trusted medical information they need to make informed decisions about the vaccination and the vaccine. Our medical and scientific experts at CDC and the National Institute of Health will be out there in the public every day to answer questions and get the facts out. We will also be partnering with the healthcare providers, schools, community organizations, states and tribes and cities at the same time. The bottom line is this. The vaccine for kids between the ages of 12 and 15 are safe, effective, easy, fast, and free. So my hope is that parents will take advantage of the vaccine and get their kids vaccinated. And let's remember that millions of 16 and 17-year-olds have also been safely vaccinated. And as more and more Americans get vaccinated, COVID-19 hospitalizations and death rates continue to fall. Today, the New York Times reported the number of COVID hospitalizations in the United States since April of 2020, right after the start of this pandemic, is the lowest. Safe and effective vaccines are curbing the spread of the virus, and they're saving thousands of lives, and allowing millions of Americans to start returning to a closer to normal life. As I said earlier, for everyone 12 years and up, it's never been easier or more convenient to get vaccinated. Visit vaccine.gov to find out where, or text your zip code to 438829. That is 438829. Text your zip code to that number, and you'll find the closest vaccine facilities to you at that moment. It's easy, it's convenient, and it's free. So if you haven't gotten vaccinated or still have questions, talk to someone you trust, your physician, your pharmacist, your next door neighbor who got the shot. Talk to your faith leaders. Look at the folks in your community who've gotten vaccinated and are getting back to living their lives. Their grandparents united with their grandkids, friends getting together again. I've been saying for a long time, but I believe it. This is not a Democratic or Republican issue. This is about life and death. It's about getting us closer to normal. Let me conclude with this. In light of the end that we've been talking about, there's a light at the end of the tunnel. Well, it's growing brighter and brighter. And we need all of you to bring it home. Americans ages 12 and up, get vaccinated. And on July 4th, let's celebrate our independence as a nation and our independence from this virus. We can do this. And as I said a little bit earlier today in another context, I don't believe that the American people, there's any significant portion of American people who refuse to get vaccinated. You keep hearing about how Republicans won't and this. Look, if it's available, if it's nearby, if it's convenient, people are getting vaccinated. I believe the vast majority of Americans are going to get vaccinated. That's the route we're going now. So may God bless you all and may God protect our troops. And if you've been vaccinated, you don't have to wear this outside around people unless there's really large groups. And you don't have to wear it inside if you're with people that that have also been vaccinated. So protect yourself, protect your neighbors. Thank you very much. Appreciate it.
Mr. President, what do you say to Americans who are worried about the supply of gas and rising prices right now?
We have been in very, very close contact with Colonial Pipeline, which is the one area you're talking about where one of the reasons the gasoline prices are going up. And I think you're going to hear some good news in the next 24 hours. And I think we'll be getting that under control. Secondly, I have, in the meantime, made it easier for us to have lifted some of the restrictions on the transportation of fuel, as well as access to the United States military providing fuel and with vehicles to get it there where places where it's badly needed. And I'd also point out that I think what this shows is that I think we have to make a greater investment in education as it relates to being able to train and graduate more people proficient in cybersecurity. And I've been saying for a long, long time now, I know you could probably say it for me, but I think that one of the most important things we have to do to reclaim our place as the leading innovator in the world is to have a better educated workforce. And that goes back to the days a long time ago now, or 5 years ago, when I was vice president, and I surveyed all the Fortune 500 companies, said, what do you most need? And remember what they said, better educated workforce. But they're not spending money to educate the workforce. And but it's important that we do this. And the cybersecurity piece is one I think you're going to see where we need significantly larger number of experts in the area of cybersecurity. working for private companies, as well as private companies being willing to share data as to how they're protecting themselves. I think that's part of the long-term answer, not just in terms of energy, but across the board. I know that's not a direct response to your question, but it does impact on it, I think, down the road.
Are you concerned about the violence in the Middle East, and can you talk about what conversations you have had with officials there?
My national security staff and defense staff has been in constant contact with their counterparts in the Middle East, not just with the Israelis, but also with everyone from the Egyptians to the Saudis to the Emiratis, et cetera. And I had a conversation with Bibi Netanyahu not too long ago. I'll be putting out a statement very shortly on that. My expectation and hope is that this will be closing down sooner than later. But Israel has a right to defend itself when you have thousands of rockets flying into your territory. But I had a conversation for a while with the Prime Minister of Israel, and I think that my hope is that we'll see this coming to conclusion sooner than later. Thank you.
What's your take on the end of your meeting, sir? Were you optimistic coming out of it today?
Which one of the 12 I've had?
Infrastructure, sir, and in particular.
You guys are bad. I'm not supposed to be answering all these questions. I'm supposed to leave, but I can't resist your questions. I came away encouraged, but I want to make it clear to you. I'm encouraged not just because of a solid meeting with the Republican leader in the House and with Mitch or Senator McConnell, who I've known a long, long time and work with. I've been meeting with bipartisan leaders for a long time now. I've met with gosh knows how many. I mean, and there's more than one single group. There's bipartisan groups made up of 10 to 20 members. There's been groups that I met with. For example, I met with yesterday with Kristen Sinema. I thought that was and she purported, and I believe her, to speak for some of the her friends who are both sides of the aisle about how to go forward with infrastructure. So I'm encouraged that there is room to have a compromise on a bipartisan bill that's solid and significant, and a means by which to pay for it without dropping all of the burden on middle class and working class people. Look, what's the one thing people are concerned about with the gas? Gasoline prices going up. Exactly right, and it matters if you make $40,000 a year. It matters if you're a two-family person that making $80,000, $90,000, two wage earners. It matters. And what I don't want to do, and this will be another discussion we didn't get into today, is how to pay for it. And if everything is paid for by a user fee, well then, the burden falls on working class folks who are having trouble. We're getting them out of they're coming around. But this has to be a burden shared across the spectrum. Anyway, thank you, guys.
Should Americans be worried about inflation, sir?
Well, thank you for listening to Policy and Rights today here on Depictions Media Radio. And, of course, I am Michael Clogs, your host today. And I want to impress upon everybody that we need to live under the ideas of peace and giving help and helping spread the bounty and the plenty that is all around us on our planet, and that we should be working towards helping those who need cures from disease. We should avoid spreading disease around and help those who have been abused, as well as let's make sure that when we all need to pull together from a massive disease spreading, that we connect everyone together with help and health. Please do connect with us on our contact page at depictions.media. If you also do click on any link that you see that will give you more information, help you see our world in a more loving and peaceful way. Please do let us know how we can help, either with news stories that we can cover or how we might be able to interview you or help spread your message. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.